Before the COVID-19 response, I was in charge of I was managing the Scripps Health Express clinics. Again, the manager of operations for all of the sites across San Diego. When we first started out, we heard that, we need to respond to COVID-19. There was this, I relate it to like a stock market type of floor, and having to get things put up fairly quickly. This area is made up of all registered nurses. We have to be able to respond to the patient because the patients were like, what do we do? So we got this nurse line put up, and initially we had to work with IS and we had to find space. So one day I get this call saying, we need to find space, and IS is coming over, and all of a sudden there's like 15 computers, 15 phones. We had initially 50 nurses on the second floor of Campus Point. And this was like every day we're just growing and growing and growing. The response from the community was overwhelming at first. I remember the first day we turned our phones on, and I'm not kidding, we had like 2,000 calls coming in, trying to make sure that we communicated what we needed, and we were following all the guidelines and asking all the right questions. Because we had already established this video visit modality for a lot of our patients in Health Express, it seemed to make sense that if patients had symptoms of COVID-19, instead of bringing the patients into the site to keep the patients safe and to keep other patients safe that may not have been exposed to COVID-19, it made sense to conduct video visits for these patients that displayed symptoms that called our nurse lines. They call our nurse line, and the nurse line schedules the patient for a video visit using our Health Express team. We started off at Torrey Pines, was our first cabana. We got that up, started off really well. We again had the urgent care support. They supplied all of the PPE gear and all of our swabs that we needed for our patients. And then we moved from Torrey Pines. Well, we didn't move, we set up 2 more cabanas within the next couple of days. One at Cedar, and then the other one at Rancho Bernardo. At one point, we had 8 or 9 patients on the schedule to be tested. And we staffed that cabana with the Health Express team. And I kind of teared up a little bit this morning just thinking about it, because I was, so humbled by just by the experience. And just kind of just how everybody rallied together to put the patient at the center. Put the patient at the center of what we're doing, and just really taking into consideration the safety, not just of the healthcare worker, but also the patient. Like when you hear we're all in this together, like that's a true fact.